Once again, good morning, students. So, we will continue with the growth and development. Now, our second part is like factors affecting growth and development. So, what are the factors generally affects the growth and development of a child? So, here comes the factors, that is the genetics or the hereditary, sex, racial and national characteristics, nutritional factors, environmental factors. So we can see one by one in detail. So the genetics and hereditary. The hereditary of a man and a woman determines that of their children. So usually when you are observing in a family, the family members will have physical resemblances. Maybe the color or the height or the facial appearance or some resemblances will be there. Differences will be there between families, but within a family, people will have more resemblances. So members of the families bear physical resemblances to each other, and a high degree of correlation of stature with weight among siblings exist. So this is about the hereditary or the pattern of growth and development within the family. So ഹൈറ്റ് കുറഞ്ഞ പാരൻസിന് ഉണ്ടാവുന്ന കുട്ടികൾ കുറച്ച് ഹൈറ്റ് കുറവായിരിക്കും. അതേപോലെ തന്നെ ഹൈറ്റ് ഉള്ള ഫാമിലി മെമ്പേഴ്സിന് ഹൈറ്റ് ഉള്ള കുട്ടികളായിരിക്കും. നല്ല ഫാറ്റി ആയിട്ടുള്ള തടിയുള്ള അപ്പനും അമ്മയും അല്ലെങ്കിൽ എസ്പെഷ്യലി ചെറുപ്പത്തിൽ അവർക്ക് നല്ല തടി ഉണ്ടായിരുന്നു എന്നുണ്ടെങ്കിൽ കുട്ടികൾക്കും അതേപോലെ ഏകദേശം ഒരു ഫിസിക്കൽ റിസംബ്ലൻസസ് അതേപോലെ ഉണ്ടാവാനുള്ള സാധ്യതയുണ്ട്. The rate of growth is more alike among siblings than among unrelated persons. So, മൂത്ത കുട്ടിയുടെ അതേ ഒരു അനുപാതത്തിലായിരിക്കും സെക്കൻഡ് ബേബിയും അല്ലെങ്കിൽ തേർഡ് ബേബിയും ഉണ്ടാവുന്നത്. എപ്പോൾ ഇരിക്കുന്നു, എപ്പോൾ നടക്കുന്നു, അല്ലെങ്കിൽ എത്രമാത്രം തൂക്കമുണ്ടായിരുന്നു എന്നുള്ളതെല്ലാം there can be a comparison between the siblings comparing to other unrelated persons. So, this is about the genetics and hereditary when you are talking about growth and development. So, hope you are clear. The second factor is sex. So usually sex is determined at its conception. So when the child is conceived during that time itself, the sex of the child is determined. And according to the sex, there will be differences in the growth and development of children. That is, after birth, male infant is both longer and heavier than an female infant. And boys maintain the superiority until about 13 years of age, and girls mature earlier, reach the period of accelerated growth earlier than boys, are then taller on the average. So bone development is more advanced in girls than in boys. So there will be some differences. So after birth, boys will be more longer than the girls, and after 13 years, the girls become more mature more earlier than the boys, and during that time there will be more height and weight for the girls comparing to the boys, and towards the adulthood the boys gets the superiority in the height and weight. So this is what is happening. There will be differences between the male and the females in growth and development. So this is about the second factor, that is sex. Racial and national characteristics, that is growth potential of children, differ between different racial and national groups. So വളരെ clear ആയിട്ട് അറിയാം, black people or the foreigners, especially Arab people, they have their own a unique growth and development pattern, and they have some amount of big size and growth comparing to the ഇന്ത്യൻ ചിൽഡ്രൻ. സോ ഒരു അറബ് കൺട്രീസിൽ ഒരു 4.5 kg എന്ന് പറയുന്നത് ഒരു നോർമൽ ബർത്ത് വെയിറ്റ് ആണ്. ബട്ട് ഇൻ അവർ കൺട്രി 2.5 ഇസ് എക്സ്പെക്റ്റഡ് നോർമൽ ബർത്ത് വെയിറ്റ്. സോ ഈ 2.5 kg എന്ന് പറയുന്നത് അറബ് രാജ്യത്ത് അതൊരു പ്രിമച്വർ വെയിറ്റ് ആണ്, അല്ലെങ്കിൽ പ്രീമച്വർ ബേബി ആയിട്ടാണ് അവർ കൺസിഡർ ചെയ്യുന്നത്, ലോ ബർത്ത് വെയിറ്റ് ബേബി ആയിട്ടാണ് കൺസിഡർ ചെയ്യുന്നത്. പക്ഷെ ഒരു ഇന്ത്യൻ ബേബി അനുസരിച്ച് അതൊരു നോർമൽ വെയിറ്റ് ആണ്. സോ ദിസ് ഇസ് ദ ഡിഫറൻസ് ബിറ്റ്വീൻ ദ നാഷണൽ ക്യാരക്ടറിസ്റ്റിക്സ് ഓർ ദ റേഷ്യൽ ക്യാരക്ടറിസ്റ്റിക്സ്. Next is the nutritional factor. So Definitely, we know that the importance of nutrition on the growth and development. So, the nutritional deficiency of proteins, calories, minerals, vitamins, and essential amino acids, both quantitative and qualitative, considerably retards physical growth and development. So, this is about the importance of the nutritional factor. So, when there is any deficiency, it will retard the physical growth and development of children. There is nothing to tell. Any deficiency, maybe a protein, calorie, vitamin, mineral, amino acids, maybe in quantity or quality, both will affect the growth and development of children. And overnutrition beyond a limit may cause obesity. So that also we should expect. So children may get overnutrition leads to obesity. Next factor is socio-economic factor. So poverty is associated with diminished growth, and children from well-to-do families usually are better nourished and they will be having better growth and development comparing to unprivileged children. Next is the environmental factor. So when we are talking about environment, we have to consider the prenatal and the postnatal environment, because in the definition of pediatrics itself we have started, that is, child will be taken into pediatrics from conception till adolescence. So the prenatal factor, that is during the conception and after conception till the birth of the child, is considered prenatal period, and the postnatal period, that means after birth of the child, it is considered postnatal environment. So the prenatal environment factors can be maternal health practices will affect the growth and development of the fetus. If the mother is consuming some alcohol, smoking or any drugs, everything can happen, can alter the development of the child. So the mother health conditions, that also very important. Next is a maternal nutrition, because the child consumes nutrients from the maternal blood. So if the mother is lacking good nutrition, then definitely the child also will be affected. The diseases during pregnancy, any iron deficiencies or folic acid deficiencies, then maternal diabetes or gestational diabetes mellitus or pregnancy-induced hypertension, any diseases during pregnancy can alter the growth and development of fetus. Administration of some drugs can adversely affect the embryo. It can be a thalidomide, antipsychotic drugs, cancerous, anti-cancerous medicines, anything can affect the growth of fetus, and hormonal influences also will change the prenatal environment. The postnatal environment, the nutrition may be starting from the breastfeeding, weaning, and after that also what child consumes definitely influence the growth and development. Socioeconomic factors already we have discussed. Infection and diseases like persistent and recurrent infections of the child will adversely affect the growth of the child. Diseases of the heart, chest, kidneys, liver, neoplasms, digestive and absorptive disorders impair the growth. This all will impair the growth of the growth and development of the child, especially the infections, diseases, and diseases of major organ systems also will affect the growth and development. Next is the emotional factors, like children from broken homes and orphanages do not grow and develop at an optimal rate. Their development may be abnormal, like emotional development, cognitive development. These all will be affected more than growth of the child. So next is cultural factors. Methods of child rearing and infant feeding in the community are determined by the cultural habits and conventions. There may be religious factors against consumption of particular foods. So these are the cultural factors like vegetarian, non-vegetarian, or taking some food or not taking some food. This all will be happening according to the cultural practices of the family. So these all will affect the growth and development of children. So this is about the topic of today. So we have seen what is the growth and development, and after that we have seen regarding the factors, the genetic and hereditary, sex, racial and national characteristics, nutritional factors, socioeconomic factors, and environment. Environment we have divided into prenatal factors and postnatal factors, and the prenatal environment and the postnatal environment. So hope you understood the topic. Write down the notes and submit the assignment today itself. Thank you.